Hello guys, can you just imagine waking up one day and realizing that your world is fading gradually, silently, without any sign, no symptoms, but total darkness that just crept in just like a thief in the night? This is the terrifying reality of glaucoma, the thief of vision, the silent destroyer of eyesight. And all you need to do is just to pay attention, follow my video, watch my video to the end, cause in this video I will expose all the hidden dangers, all the hidden secrets associated with glaucoma, how it come and steal away our vision, the signs and symptoms, the possible causes, how it can be diagnosed on our own without necessarily going to the hospital before it is too late, before the darkness come to play. Please, if you are watching my video for the first time, please kindly press the subscription button, like, share and comment on my video. Subscription is free, and if you are a returning subscriber, God bless you. I'm still that your humble brother and your friend Stephen Oluwatumininu. Now let's talk about glaucoma, the thief of our vision, the silent destroyer of eyesight. How does this occur? There's what we call aqueous humor. This is the fluid that is located in the anterior chamber of human eye. Now, the rate of production of this fluid must be equal to its drainage. Now, before we can diagnose someone of having glaucoma, the person must have these three things. Number one, increase in intraocular pressure. Number two, cupping of the optic disc. Number three, peripheral loss of vision or gradual blurring of vision. Now, this increase in intraocular pressure occur when the rate of this aqueous production is not the same with the drainage. That is, when the production is ongoing and the drainage is being decreased. This will gradually lead to accumulation or backlog of this aqueous humor in the anterior chamber of the eye, now compressing on the optic nerve, which is located at the posterior segment of the eye. The optic nerve partake in the transmission of a neural signal from the eye to the brain for interpretation. Now, when this increase in intraocular pressure compress on this optic nerve, it deprives the optic nerve fibers of blood supply, nutrient supply, leading to the paleness that we call optic, cupping of the optic disc. That is how we used to grade it. When there is paleness of this optic cupping of the optic disc, or the deprivation of the optic nerve of blood supply, nutrient supply, it will surely affect its functions, which is the transmission of a neural signal from the eye to the brain for interpretation. And this is how blurring of vision sets in. This is how peripheral loss of vision usually sets in. Now, how does glaucoma actually occur? It can be caused by series of factors, but there's what we call primary open angle glaucoma and primary angle closure glaucoma. In primary open angle glaucoma, the rate of drainage is continuous, while the rate of production is continuous, while the rate of drainage is gradually decreasing, leading to this backlog that I've just explained. And that is why it passed no symptoms, it passed no signs, no warning, because it occurs gradually. But in primary angle closure, the drainage angle will get blocked just suddenly. And in this case, an individual can be experiencing pain, headache, redness, blurring of vision, nausea and vomiting. And I do tell people that are experiencing all these signs as being a lucky person. Why do I say is a lucky person? Because you even have some signs and symptoms that must have necessitated you to go to the hospital or to go to the nearby eye specialist for early diagnosis and prompt treatment. Because this is a kind of discomfort that you may not be able to bear, compared to the one that silently steals away your vision with no sign, no symptoms and no warning. Now, other causes and predisposing factors are age. An individual that from the age of 40 upward, you are predisposed to suffer from glaucoma. Now, hereditary. If you have a grandparent or your parent that are suffering from glaucoma, then the World Health Organization recommend it for such individual to go to the hospital. Either you are experiencing or not experiencing any signs or symptoms, you are to go to the hospital for regular eye checkup at least twice in a year, because it runs in the blood. The third one is systemic diseases. We have some systemic diseases like hypertension, diabetes. If you are suffering from any of these, please, you are liable to suffer from glaucoma. We also have some eye disorders like uveitis, inflammation of the uvea tract. Please, you are liable to suffer from glaucoma. Another thing is prolonged use of steroidal drugs, steroidal anti-inflammatory drugs like prednisolone, dexamethasone eye drop, Spasadex. All these drugs are being used in treatment of some inflammatory diseases in the eye. Please, you have to stop the usage of prolonged usage of steroidal drugs, or you use it with caution. Make sure it is being prescribed by an eye specialist, because the prolonged usage of it can result into glaucoma. We have post-surgical implications. At times in some surgeries, post-operatively, an individual can just start to develop increase in intraocular pressure, which will result into glaucoma. We have some tumors, and also we have myopia and hyperopia. All these are predisposing factors or risk factors of glaucoma. Now, how can we detect that we are having glaucoma on our own without necessarily going to the hospital? Number one, I will advise you that when you wake up every morning, try to test your distant vision. How do you do that? You have to close one of your eye, then focus at a distance. Note the characteristics of either object that you've actually focused. Open that eye, close the other one, and try to compare the vision you have in one eye to the other eye. If you open your eyes at a time, you might not be able to know if one eye is already lost or not, or if one eye is already blind or not. You might not be able to do that, because the two eyes do compensate each other. Now, a woman once presented to the clinic with a serious frontal headache. Now, on examination, we realized that this woman is suffering from glaucoma. On doing the visual acuity outside, which is the one of the assessment that is being done when you come to the eye department, we asked her to close one eye to read the Snellish chart. She closed one eye, she read it. We asked her to now open the previous eye and close the other one. It was at this moment that the woman realized that one eye has already gone, that is, one eye is blind. And what actually brought her was frontal headache, not even any eye discomfort. But it was on getting to the hospital that she was now being referred to the eye department, where we were now about doing the visual acuity, before she realized that one eye has already gone. This is how bad glaucoma can be. So please try to always examine your eye one at a time. Close one eye, open, and close the other one, open. Compare what you can see in the two eyes. If there's any difference, definitely there's something wrong with your vision. Another thing is testing your peripheral vision. I do say our eye can only see at a peripheral or at a parameter of 180 degree, which is half of a cycle. That is, we don't have two eyes at the back of the skull. We only have eyes at the front of the skull. That is, from the two sideways of your two ears, like this, come to the front, is expected to be your peripheral vision. That is the circumference of the peripheral vision, and it is 180 degree. Now, when you fix your eye at a point, without necessarily turning your eye to the right or to the left, just pick a point in front of you, fix your eye there, then you are expected to see whatever is located from this your ear, down the corner of that your ear. You should be able to see what is located there, and from the other ear you should be able to see what is located at your two right side ears, without necessarily turning your eye to the left or to the right. that is your peripheral vision. And if you are unable to see any object that is located at your two, sideways of your ear, definitely gradually you are losing your peripheral vision, because in most cases people will be seeing their distant vision very clearly, whereas there is a gradual loss of peripheral vision going on gradually without them noticing it. And that is why we call glaucoma the thief of vision, the silent destroyer of eyesight, because in some cases, like in primary open angle glaucoma, it will pass no sign, no symptoms, no warning, but it is when it has totally destroyed one eye before jumping to other one that an individual might realize that, oh, one eye is gone. Just like the woman that I just told you about, that didn't even realize that one eye is gone and it has already set in the other eye. May we not get blind. So please, how can we now prevent this from occurring? Number one, regular eye examination. Just like I said, World Health Organization recommend it for an individual to go for regular eye examination at least twice in a year, because the prognosis to any eye disorder is early detection and prompt treatment. That is what will give you a better prognosis. Another thing that we have to do is to control the risk factors. What are these risk factors now? If you are suffering from diabetes, you are expected to keep your blood sugar under control, under the normal range. Let it be within the normal range. Blood pressure, you are to control your blood pressure. Make sure it is within the normal range. If you are suffering from diabetes or hypertension, it should be kept under control. If you are a type that do smoke, please, it is high time you quit smoking. Adopt a healthy lifestyle, because all these are the predisposing factors of glaucoma. Another thing is, make sure you adopt eating diet that is rich in omega-3 fatty acid. Although I've done videos about some food, best food that can improve your vision, best food that can, give you a better distant and near vision, you can go to my YouTube channel, Stephen Oluwatumininu on YouTube, and you will get more of this video on those food, necessary nutrients that are beneficial to the eyes and our vision. Another thing is medication adherence. If you are now being diagnosed of having glaucoma, please make sure you adhere to your medication. Take it as it is being prescribed, because the moment the intraocular pressure is being increased, it will keep destroying the optic nerve that play a vital role in transmitting a neural signal from the eye to the brain for interpretation. Please, our vision is very, very important. Let us learn how to be able to take care of our vision. Let's cherish the gift that God has given to us, because if you get close to people that are blind, let them share some of their experiences with you. Honestly, it is at that moment that you will realize the good or the golden opportunity which God has given to you, that you don't even realize it, that you don't mind it. Now, if you have actually benefited from this my video, don't forget to press the subscription button, like, share, comment on my video. And if you are a returning subscriber, God bless you. I'm still that your humble brother and your friend, Stephen Oluwatumininu. You can visit my YouTube channel at Stephen Oluwatumininu for more of educative and informative videos on general well-being, how you can generally improve your well-being. Thanks, and God bless you for watching.